Welcome back. This is part two in my series of nursing process and understanding care planning. And part two is anatomy of the care plan. So to recap a little bit, last series in part one, we strictly went over a lot of history and appreciation, where today we are going to go more into the actual parts of the care plan and how nursing and medicine work together to care for patients. So let's start out with just some formatting things. In the top corner here, where you see the columns, this is a very traditional style care plan that was done many years ago when I was in nursing school. Everything was just in a column. You listed your problem, you listed your nursing diagnosis, what were your objectives, and what were your interventions. And then it seems like we had another column over here with the evaluation that was the short and the long-term goals that we would break that down into. And when I started teaching, what I noticed is that there was a lot of new technology, not new to you, but definitely new for me. And it was difficult to get the formatting and the computer portion to actually work and function in the order of what you would actually do things. And so at the time, concept maps were a big deal. And so I like concept maps because it goes into a lot of information about the background, and I think it marries nursing and medicine a little bit better. And I like the visual mind mapping type of things around it. But historically, concept mapping came along when we were trying to make a better connection between what are we doing specifically as nursing and how is it tied into what's going on as in medicine. And then in this bottom section, you're going to see that there is a very traditional next gen question. And the reason I put this in here is not that this is a care plan, because it is not, but it shows you in formatting issue how things are changing and how technology is more interactive. And if there's information in an unfolding case study, and a lot of times now you may be doing writing unfolding case studies as opposed to a traditional care plan. With the technology, especially on NextGen, you can click from tab to tab to get additional information that you might want. So let's move on to an analogy. And the reason I came up with an analogy is because as a new educator, I was really struggling with how to relate to students. Specifically, students are so stressed out in clinical setting and in the classroom setting that it is just imperative that we need you to relax. If you're going to learn anything, you have to relax. You're not going to understand without being able to reflect, and you're not going to be able to reflect until you can relax and start to process sort of part of that information. So what came to me was an analogy of a river for several different reasons. As I've mentioned before in part one, this is a very fluid process. It's not a step 1, 2, 3, 4, 5. It doesn't work well on a computer format. It does better now, but it didn't then for sure. And so it's a very fluid process. You can't, and what makes it more difficult is that it's constantly moving and evolving. And so very much similar to fluid and rivers and waters. And so what I would start out with in the clinical setting was to just ask students to close their eyes, take a deep breath, play some soft water flowing music, and do a quick relaxation exercise. And so then we started talking about, well, let's look at the anatomy of a river. And you have to start with a water source somewhere. And from that water source or that spring or that well, you have creeks that turn into tributaries that flow into rivers. And from rivers, you have waterfalls. And so the analogy is, your patient, depending on what is going on, is at one particular waterfall in their life or another. And so that's kind of where this analogy has come into place. But when you look at a patient's problem, we find the patient right here, usually, or sometimes even closer or in the midst of the waterfall. But in that pool right behind the waterfall, that's when your presentation of illness is occurring. Are they going to the ER because they've had the flu for several days and the doctor's office is closed, or what have you? Or is this a patient went into the doctor's office and they really are sicker than what they thought they were, and so they end up in the hospital after that? Of course, my analogy is a hospital setting because that's exactly where we were. But that presentation is right here before the waterfall. That's when we hope that we catch them. But you have to go back up river to get all the information that you need to put the pieces of this puzzle together. And so those tributaries are going to be all the different things that are part of the etiology. Are there genetic factors that are playing into this particular condition? Are there risk factors? Are there behavioral issues that are putting them at higher risk? But that back information that we always have to interact with the patient and go back and get, and takes a lot of good communication skills to get the information and determine whether it's a significant part of the information or not. Now, as nurses, we don't get to choose what is significant and what is not. We document and we report that as such. But that etiology is where we find the patient. And typically we walk into any clinical patient setting and we start with a medical. We have to back up, go upriver, get what we need for the nursing, and then work together with medicine to care for the patient. So in the next slide, what you're going to see is that overlay of the nursing process. Now, specifically, the steps of the nursing process are your assessment, your diagnosis, your outcome identification, planning, implementation, and evaluation. And again, I went with the 6th step because I think it does it more so in the appropriate order of how you need to get that information. So again, this assessment and us finding nursing diagnosis takes all of this information here in that presentation of illness and the current symptoms and problems and risk and all of that back upstream information with the etiology. Your outcome identification, that is, how are we going to get them over this waterfall safely? Or what is the ultimate goal? 4, with the planning, again, hopefully we're going to be doing our planning before the major events and assisting the patient through those major events as safely and as best as possible. 5, that's the implementation, not just the plan. What are the interventions and are you doing the interventions? Not just a laundry list of things that you may or may not do. What did you actually do? And then 6 is that evaluation. Did they come through this process relatively unscathed? And so it is a very holistic approach. If you want to make sure that you have a holistic approach to any particular patient, then you're going to want nursing diagnosis from several different categories. Just thinking of your Maslow's hierarchy of needs. What are some safety and pathophysiological nursing diagnoses? What are some psychosocial diagnoses? What are some diagnoses that are that higher level of self-actualization and spirituality? So that is just a way to make sure that you're not just focusing on one particular problem. In actuality, we do have to prioritize, but to make sure that we're giving holistic care, then we need to do care plans and initiate interventions for each of those things. But as you already know, with Maslow's, you're not going to be able to function at those higher levels until you take care of those safety issues. And the same thing applies to you as a nursing student. And that's the whole reason why it took me a minute to figure out, but that's the whole reason why students are so stressed out and really have to try to get them off the ceiling to make them realize that they are safe and that they are okay and you're in a learning environment. And so it's Maslow's hierarchy of needs for you as well. You know, you have to be able to feel that those things are in place before you're going to be able to relax, before you're going to be able to learn, and before you're going to be able to do those higher levels of learning that is required for nursing, which is reflection and understanding and applying the information that you know. So let's look specifically at the care plan. With the care plan, you have the number 1 step assessment. So you're looking at a list of abnormals from your history and your physical. What have you done and what did you find as far as things that the patient reported, things that you're able to observe? What are your assessment findings? And just make a laundry list. It doesn't matter at this point if they are in any particular order or not. If it kind of dinged in your head, hey, I don't think that's right, then put it down as an assessment finding. And then what we're going to do from here is look for patterns so that we can start making a list of problems. And from those list of problems, we're going to come up with our nursing diagnosis. So again, it's going to be everything. It's going to be your subjective data, your objective data from the patient. It's going to be consults. It's going to be abnormal findings in your labs, your history, your risk factors. What are the patient's greatest concern? Are you involving the patient in this process? Because they are vital. We can't just do this blindly without them. From that, again, you're going to look for the pattern recognition. And then, when you start listing the nursing diagnosis, start with the most lethal first. What is going to kill them the fastest? If you don't have a blood pressure or heart rate that is supportive of vital functions, then that's your highest priority. And again, use your Maslow's hierarchy of needs for that as well. Okay, so moving on. The next step is the actual nursing diagnosis. So you took those 3 columns of information with your assessment findings, with the problems that you felt like those that you had with the identification of different issues and the nursing diagnosis that you have. And from that, you have picked one. So when we're looking at this slide, we are looking at one of those nursing diagnoses. So with a nursing diagnosis, it needs to be patient specific, and assessment will always come first. And so this is the nutshell of the anatomy of the care plan. We're always looking at a risk or a symptom management. What's it related to? So now you're looking at that big NANDA language, and what is the problem? So it's symptom or risk management related to one problem, evidenced by your supporting data. So again, if you're having trouble figuring out what NANDA language to use, you may need to go back to that previous step and look at those patterns, because as best as possible, you need to find the underlying problem so that you are picking the highest priority. Now, in the very beginning and your first care plans, you're going to be looking super specific just at symptoms. But as you progress through nursing school, then you're going to find that kind of care plans roll into other care plans. So an example of this would be that if, let's say that you've got a risk for fall because the patient had fallen when they came in, they're complaining of syncope and dizziness. Yes, we are going to address that risk for fall. And there's all those specific interventions that go for risk for fall. Making sure you're in a safe environment, making sure you don't have things you're going to trip over, making sure you have your call out so that patients aren't trying to rush to the restroom in the middle of the night. But as you get more into what is really going on in that whole picture of the patient, then what you will do when you become more advanced is that you will recognize that, okay, well, maybe we're beginning to figure out that this fall is from a neurological issue. And so maybe there's a tissue perfusion issue, or if it's a heart-related issue and their blood pressure is dropping and that's what's causing them to fall, then is this a volume issue? And so as you understand pathophysiology better and as you're able to look at the bigger picture, keep in mind you're going to start out very task-oriented. And if you're starting in those first steps, that's fine. That's exactly where we want you. But as you're getting closer to graduation, you should be able to look at that bigger picture. And yes, there's a risk for fall, but my priority care plan at graduation is probably going to be a hypovolemia and a fluid volume issue. And within that, we're going to have interventions for risk for fall, because obviously if someone's blood pressure drops when they go to stand up, then there is a risk for fall. And so it can get fairly complicated when they get all meshed together, but start where you are and begin with that. So I hope that didn't get too advanced too early. So let me kind of recap here. So when you pick your initial nursing diagnosis, and in my next series, we're going to look at specifically how to use your care plan book. When you look at that nursing diagnosis, you're going to find there's defining characteristics. Check and make sure, does the patient meet that defining characteristic? But basically for care plans, what we're looking at is symptom or risk management related to a particular problem and what is that supporting data. So as you're writing it, your problem, again, needs to address the source. And your supporting data is going to be everything you found in your assessment. What is your subjective data that supports this one particular problem? What's the objective data? What are the signs and symptoms? What are the lab values that support this? Are there consults that support this as well? And so it's really important that you research your pathophysiology, because your pathophysiology is going to help you better define and refine what we're doing for our patients. And so the third step of this is that goal statement, and or outcome identification. And it's going to be the exact opposite of what the problem is. So if it is that there's a risk for fall, then obviously the goal is the patient doesn't fall. So don't overcomplicate this. It is very simply the opposite of what the problem is. And then when you're setting measurable goals, typically we will require that you have a short-term and a long-term goal. Keep the short-term goal something that is very short, that you're able to observe, not something that's going to be abstractly done after you leave the hospital. And I think that will help you a lot in this process and seeing it through. If you have that short-term goal of what do I want to accomplish by the end of the shift, and then what wants to be accomplished by the end of discharge. Okay, so the steps 4 and 5 are your interventions, and that is the planning and implementation. So when you get to this step, basically we're starting that nursing process over again. Start with assessments. What assessments are you going to order? So remember from that part 1 of the series, our care plans are us leaving instructions for everyone else that's going to take care of the patient after us. So you're going to have to tell them, well, we're going to do a focused physical assessment on a neuro or mental health status every 8 hours. So be very specific. This is you telling someone else how to take care of the patient when you're not there. Ensure that there is patient safety and comfort. Again, caring is built into everything. And so those basic, simple comfort measures, that's the foundations and the fundamentals of nursing, and that's exactly what we're here to do. Look at every item in those outcomes and in that problem identification. Are you having an intervention that addresses each one of those problems? If their lab work was off, you're not writing an order for the lab work, but you're writing the order for the nurse to check the lab work. So that intervention might be written as check H&H daily or as ordered per healthcare provider, and that you'll note the outcomes and identify the healthcare provider as needed. So look at everything you listed as a problem. Do you have an intervention for every one of those things, at least one? Think about those orders. What orders were you given in the patient's chart? Does that order relate to this particular problem? And are you including things as such, especially when you're looking at education, dietary needs? This is where I think healthcare has become so segmented that we forget that it really is our responsibility. So included in your care plan needs to be your nutrition, needs to be your exercise. Are we turning the patient every 2 hours? Are we walking the patient 2 to 3 times a shift? Those type of things. So think about those consults. What are those entities doing for our patient, and are those interventions listed in your care plan? Maximize all available resources. Are you doing everything that we can for our patients? Even though it wasn't ordered, do we need to consider social services consult? And that may be that maybe you've run across information that somewhere along the way the patient's getting labeled as non-compliant, but have we really addressed the issues of, do they have the education they need and they're making that decision solely on their own? Does the patient have enough resources? Maybe they're not taking their insulin or their blood pressure medicine appropriately because they have to choose between it and keeping the heat on. So make sure that we're maximizing all the available resources, and that, if we need to send a patient home with a home health consult just to assess the home setting to see if there are additional needs there, then that's an appropriate nursing order as well. Now, In actuality, you're going to work with a healthcare provider and they're going to have to order that before it's done after the patient leaves the hospital. But that's not to say that it can't be part of the nursing care plan and our nursing orders, because what we're doing is we're recognizing that there's a need for that screening, and we are initiating the steps to see if that can be taken care of. And it may or may not be needed, but it should be in the care plan so that we are aware and addressing that issue, and it doesn't just get lost and it's a, oh, well, nobody ordered it kind of thing. So again, don't forget education. What are we going to educate the patient and the caregivers about? Are we documenting these things appropriately? Are we following up on this care plan and documenting the progress towards the goal and revising that as needed? So it's really important that we're always able to chart that this is an agreed upon plan of care, because as you can tell, this is a lot of work. And if this is not important to the patient, that's not to say it shouldn't be a care plan on the chart. But in actuality of what we're going to be able to help them with most, there needs to be an agreed upon plan of care. So the last step with the anatomy of the care plan is the evaluation. And this is just answering yes or no. Did you meet the goal? And if you did not meet the goal, what are we lacking to be able to meet that goal? We still haven't accomplished X, Y, or Z. And we're constantly revising that plan of care. And then as that plan of care is taken care of, then we're just going to continue holistically to take care of those other plans of cares that are needed to be done. So again, if you are evaluating, that means you have to have reassessed. So if you are looking at, okay, I had this goal during the shift at clinical, and did I meet the goal or not? Then that means whether you had an order for an assessment or not, you have got to reassess your patient before you leave. Otherwise, you're not going to have the information that you need to be able to update the plan of care. More importantly, you're going to be reevaluating the patient before you leave so that you can give an appropriate handoff report. So this brings us to the final reflection. And again, this was part of that process of me discovering and hoping that explaining care plans is a very fluid process, giving that analogy of water and rivers would be helpful. And so this is the reflective statement that I have based on what I have learned from this experience. It helped me to understand care plans so much better. And from that, I was able to help students in the clinical setting understand them better. So ours is a parallel journey, helping patients as best we can through the waterfalls of life. Sometimes we walk, sometimes we wade the waters, sometimes we swim. Often we feel like we're drowning, but we must climb the steps and the cliffs and start all over again. It is tireless, strength building, exhaustingly refreshing, and although sometimes tragic, nursing is undeniably as beautiful as nature. Thank you. As with every part of these series, I'm going to end it with the link to my website, which is keystosuccesslballard.com. You can find some free information there. There are forms to fill out if you would like to email and request a consult. I would be happy to interact with you there as well as here. For YouTube specifically, I hope that you will subscribe and like and share and follow. And on TikTok, if you will be sure and follow me there. I'm hoping to get enough followers on TikTok that I can do lives from TikTok. But essentially, my focus is here on YouTube. So the QR code that you see here is for an Amazon link to my book. The ebook, if you are Kindle Unlimited member, is free. If you are not, the ebook is only $4.99, and the workbook that's a printed paper back is $12. And so if you're getting close to ready for NCLEX, and if not, if you find it helpful to use this process to help get organized and to study during nursing school, you can start it now. You can't start it too early. And so that's the QR code to Amazon. As always, I want to thank you. And next in the series that we're going to do is going to be specifically how to use Care Plan Book. So I'm hoping to do some lives here on YouTube as well as TikTok, and hopefully go over some things with Nursing Care Plan and interact with you to find out How are you learning about nursing process? What would be helpful for you? I hope that you have found this helpful. I appreciate the time and your willingness to follow this journey with me, and hope to see you again in the next segment. Thank you.